Hey guys, welcome to episode 6 of our anatomy focused laser series. We're still discussing the ear and we're just going to explore, so we've talked about some of the most common conditions that do impact the ears. So would laser therapy benefit those conditions? So let's start at the top where we started in the previous video, otitis externa. There's a lot of information and a lot of pain associated with this condition. So our aims here with laser would be to reduce inflammation, pain and edema. It also supports epithelial healing alongside our medical management. And you know, I'm not going to sit here and say that laser will fix absolute every ear infection, but what it can do is obviously help reduce that pain and inflammation to help with the general management of that condition. B, enable the handler to be able to get those eardrops in more effectively because they're able to handle that patient because they're more comfortable. And C, again, if we do have patients that can't be handled at all, again, it can just help us manage pain management, or if they're unable to take let's say non-steroidals or something like that, again, it gives another option to be able to help manage them. The great thing about ears is because, you know, anything kind of external is so superficial, we see a very fast response with laser therapy. So I do really love treating otitis externa because we do literally see it reducing kind of in that inflammation, that pain very quickly. We also then have our otitis media and interna, where it starts to go from just the external surface into that inner ear. And again, we tend to use this as an adjunctive neuromodulation and inflammation control to improve comfort. We have our allergic otitis. This helps manage chronic inflammation and load and discomfort in recurrent disease. Again, if it's allergic in nature, it's not necessarily going to do anything for the allergy, so we still need to address that. However, it's just going to help manage some of those symptoms where, again, pain, inflammation. We're then going to oral hematoma. Now, this one's an interesting one. Oral hematomas are not inflammatory by nature. So a laser isn't necessarily going to fix an oral hematoma. However, more commonly than not, an oral hematoma is associated with an ear infection originally. So it's normally that the patient has an ear infection. They're obviously traumatizing that area because they're painful, and then they get a hematoma. So it may be that we're using the laser to help manage that infection. And then secondary, that post-drainage healing. So if it does need surgical management, where they go in and they'll cut open to be able to drain that ear, then we may be able to use laser then to help with that healing and help reduce inflammation and pain, and then that patient is again less likely to continue causing trauma to that ear. So it's not going to fix the oral hematoma itself. It's more the causes of it, if you know, like I say, if it is an infection or that post-surgical element that we would use it. Foreign bodies, again, it's not going to magically pull that foreign body out of there. So we're still going to have to use our traditional, commonly obviously surgical methods of getting whatever it is out. But it can again help to accelerate any tissue recovery, reduce inflammation after removal, especially if it's been, you know, if it's something that's been in there causing a bit of damage to those tissues, just make it a lot more comfortable post removal. Ear mites, again, it's not going to address the ear mites themselves, but again, provide that comfort and reduce inflammation once the parasitic cause has been treated. Does it make it, again, more comfortable so that any drops that need to be applied can be applied more efficiently? And then finally, our chronic ear disease, again, same story here. It's going to help support reduction in pain, inflammation, help with that tissue health, and again, pain control where we may have fibrosis present. If we've got that acute infection that's going to lead into chronic, again, helping to reduce that fibrosis wherever we possibly can is just going to help manage that ear longer term. And So with all of these, you can see, you know, it's not necessarily a laser is going to fix the entire problem, but it can be part of that multimodal approach. Enable owners to administer medication more effectively. I have my own cat recently had ear infection and very difficult to get near her. She's a tortie, so she doesn't like to be messed with. We did a bit of licky mat training and I was using the laser off contact to make her more comfortable until she was then happy for me to then apply the drops. So it's just enabling better treatment administration and then better outcomes as a result of that. So I hope that helps and gives you an idea of where we may use laser. Stay tuned for our next video because we're going to then look at how do we actually apply laser, and it's a little bit more different than you may think. There's 2 steps to it. So I'm going to go through both steps on how to get the most effective laser treatment. So stay tuned for that. And as always, if you have any questions on different ear conditions and how laser might help, then drop the comments below.